first speaker for this evening will be Dr. Charles Stewart. Dr. Stewart is board certified by the American Board of Orthopedic Surgeons with special interest in arthroscopic and reconstructive surgery of the knee and sports medicine. Dr. Stewart graduated from the University of Maryland Medical School, completed his internship and residency at the University of Florida, and his fellowship at Johns Hopkins Hospital. Dr. Stewart has been Boca's orthopedic surgeon since 1984 and has been an associate of the Boca Raton Orthopedic Group since 1993. It's our pleasure to present Dr. Stewart to you this evening.
Thank you, Janet. Thank you all for coming this evening. I appreciate this. You know, it's interesting. When I'm introduced as a surgeon, the first thing people do is they tighten up. You say, I don't want any surgery. That hurts, and there are complications. And really, I should have on there educator. I feel my job as an educator, my job is to help you understand your bodies. My job is to help you take care of yourself. And so what I'm going to do tonight, the subtitle of my talk is Motion is Lotion. When I first see people in my office, the first thing I ask them is, what do you do for exercise? And what do they say? Well, I walk a lot in my job. I said, well, I know you're up on your feet all day, but what do you do for exercise? Where do you lift weights? How much do you stretch? And I think it's very important that we do something all the time. First of all, arthritis. We almost all have it. 75% of people over 65 have arthritis of one sort or the other. So arthritis is from the Latin joint and inflammation. There's two types of arthritis. Rheumatoid arthritis, which is really a disease of the joint lining. That's a rare disease. You may have some friends that have it. 10-year-olds get it. 50-year-olds get it. It is a completely different disease and one that we don't see that often. And truthfully, the joint lining gets inflamed and irritated and produces an arthritic condition. The second type, and this is immune-mediated. It's inflammatory. It's not wear and tear. The second, of course, is osteoarthritis, and that's what most of us have. It's much more common, and osteoarthritis has a thinning of the cartilage. It's the wear and tear. It's the one where athletes get later in life. There are several etiologies of arthritis, and the first is idiopathic. There are people I see who have had no injury. They're 5, 6, and 140 pounds, and they have arthritis. And they go, that's not fair. And you're right. As I tell my children, life's not fair. But there are people. Most people, though, have a secondary arthritis. They have obesity. It's the most common cause of arthritis. The more you weigh, the more joint friction there is, and the more you'll have arthritis. Many times, people who get tears in the meniscus will, let's see, how does this pointer work? There it is. Tears in the menisci, they will accentuate arthritis. There's some people who just have bad genes. Their mother had arthritis, their father has arthritis, their brothers have arthritis. It does run in families, there's no doubt. There are people who have congenital anomalies. The most common is bow-legged. You've seen the 5-year-old and 12-year-olds, and he continues as he gets older, his legs bow and bow more. That will lead to arthritis later in life. Gout. Gout is another precursor for arthritis. And then infections. The person who had an infection early in life, that infection can destroy the cartilage and lead to arthritis. And in arthritis, basically instead of having nice, smooth cartilage on the end of the bone, it is worn away, bone spurs occur, and you get rubor, color, and dolor, the Latin for red, hot, and tender. So they hurt, they're swollen, and they're often very warm to touch. And so the first thing we talk about is, after we talk about their pain, is how to get back into doing things. Some people I'll send a physical therapist. But if you have a beautiful club like this and you know how to use the facilities, I have people start doing non-impact exercise. Swimming, the elliptical machine, a bike, treadmill if your joints are okay, but treadmill has impact. There's something called open and closed chain exercise. Closed chain is a bicycle, is an elliptical. Your foot never leaves the platform. Consequently, there's no impact. Treadmill is great if you have no arthritis, but each time your foot leaves the ground, there's an impact. So I prefer other types. Anaerobic strength training, very important. Jack LaLanne, pictured here. And strong muscles are so important because they absorb the shock, they protect the joints, they protect your body from injuries, and most importantly, improve balance. There's an article the other day how 417,000 people in this state fell and had fractures last year. Many from imbalance. Some from the parking bumpers out front, which we've been accused of sponsoring them, I might admit. But it's really, many people fall because their balance is poor. So balance is so critically important, and that comes with strength training. So how to start flexibility, another very important part of this. And I must admit, I'm guilty about not stretching routinely. I always do my cardio. I always do my weights. I don't always do my flexibility. Endurance exercises. And what we're aiming for is to do 30 minutes a day of cardio. I used to do 30 minutes every other day. I'm up to 45 minutes now, and I feel much better. I start my day with it. I get up in the morning, I do my elliptical machine, and then I go to work. And I have to say, it gets me through the day. I guess it's getting older now, because when I was younger, I'd go home and run. And now I don't have the energy at 6 o'clock to run, so now I do it in the morning. And of course, one of the safest for arthritics is aquatic therapy. Walking is another one. Biking. I love biking. I don't like biking out on the street because it's dangerous, but I like the exercise bike because there's no impact. Now, how to begin? Basically, you have to start someplace, and the best place is to start with just 10 minutes, 5 times a week. Go ahead and take a little walk, ride the exercise bike. The worst thing is you have a friend who's really in good shape, and he goes, come on, walk with me. He walks for 45 minutes. He's talking up a storm. You can't hardly breathe. You're dragging, and you say, I'm never doing that again. But like anything, like my mother-in-law says, one of the few things I like, energy begets energy. The more you do, the better you'll feel. So start and just work your way up. Now, how do I stay consistent? Set up a plan. Make a plan. Write it down. Set goals for yourself. I think it's very important. For my patients, I actually have them write a piece of paper and put it on the refrigerator door. It says Monday, Tuesday, Wednesday, Thursday, week 1, 2, 3, and 4. And write how much they do something. And they love to see, wow, I could only walk 10 minutes. I'm up to 30 now a month later. So people like to see progress. We'd like to feel proud of ourselves. How much TV do we watch? We have time to do that. We have time to do 30 minutes of exercise. It's a habit. It's getting into it. And it's seeing the results. Once you do it, you feel better. You feel good about yourself. And vary your routine, meaning do different exercises. I do the elliptical most mornings, but I take a walk on the weekends.